Well, hey, it's been a while since I've put a video up. This should be a few minutes, 5 or 6 or 7. And this one is regarding additional precautions in psychotherapy. But I'm dealing around the term of what's called psychobabble. This is a term that's frequently used by professionals in mental health, psychology, counseling, even psychiatry, where terminology just becomes blah, 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 blah. So I want to point out a couple things right to begin with. If you hear the term personality disorder, so-and-so, that you're in counseling, but you're talking about your father, your brother, your sister, your wife, your children, your so-and-so, your boss, and you hear the term, well, that person has a personality disorder. I'd like to point out, and this is in contradiction to the Diagnostic and Statistical Manual, personality disorder is not a mental disorder. We are in a field, including me, a retired clinical psychologist, in a healthcare field. Healthcare is devoted to, oriented to people with an illness, a pain, or whatever. So, people that are schizophrenic, there's a psychiatric disorder, psychological disorder, a medical disorder, whatever. People that are depressed have a psychological, medical, psychiatric disorder. People who have a personality disorder, often they're not in any pain. They're a pain in the ass to everybody else, but they're not a pain in themselves. They're not suffering. My point is this, and I'm going to close it out. Personality disorder was implemented approximately 35 years ago because originally these were called character disorders. People with gambling habits, mean people, gangsters, gamblers, these were all called character disorders. But there's something wrong with their behavior. They're bad people, or mixed up people, or confused people, or angry people. That's not necessarily a mental disorder. That doesn't necessarily mean they're in pain. So the point is, the mental health system said, oh, we got to put these things into the mental health disorder thing so that they're included. No, it's still bad behavior, disoriented behavior, mean behavior, confused behavior, whatever it is. I mean, the diagnosis of borderline personality disorder, if you hear that from a psychologist about you, a friend, an opponent, somebody you're in a problem with, start to run. And here's the worst of this all. So I said that thing about personality disorders. It's not a mental illness. It's still a behavior disorder. It's a character disorder. And the Diagnostic Manual of the Psychiatric Association was stupid to take this out of that 35 or so years ago. People with a personality disorder, unless they say, I'm really sick, I'm really in pain, I'm really troubled, it's not a disorder. And you try to find a person, an individual with a personality disorder, who goes to a psychiatrist, I'm so sorry, I have a narcissistic personality, I'm in pain. Or I have a gambling addiction personality disorder, I'm in pain. All that bullshit. So, now back to you as an individual going for therapy. And typically people going for therapy, it might be you, have a difficulty with an individual in their life. It may be a very important person, a child, a brother, a sister, father, mother, boss. And you may fall into this chasm, often promoted by a, quote, counselor who wants to talk about the person who is troublesome in your life, when in fact you're in that room, you're in that office because of troubles in your life and the troubles inside you. Not inside the other person, inside you. Something you can't deal with about the relationship, the person, or whatever. And I've had friends, and unfortunately a family member, but heard of many others, and you'll hear it on television, the term is thrown around, and the family member came up and says, well, I went to them and they said, my boss has a narcissistic personality disorder. He's a narcissist. Now you're hearing this term thrown around on television, on the news, about people in politics, people in business, people who did something wrong in Hollywood. That's a narcissistic, and most of them can't even define what the hell a narcissistic personality disorder is. And as I pointed out minutes ago, it is not a mental disorder. It's a behavioral disorder. It's like a crook, a thief, a no good SOB in somebody. These are behavioral difficulties. They are not necessarily mental disorder warranting a diagnosis in the Diagnostic and Statistical Manual of the American Psychiatric Association. It's goofy stuff. Again, watch for terms like personality disorder. I'm going to give you one more before I close out this session. Oh, so you're so-and-so that you're having a lot of trouble. Your wife, your husband, your boss, your brother, your sister, your child, important people in your life. And the word you get is, sounds like a toxic personality to me. Toxic personality. That person has a toxic personality. Stay away from that toxic personality. So it doesn't do anything for you except stay away from the toxic person. So your problem is somebody else. Your problem is, anybody with a toxic personality. Well, as far as these counselors and mental health people, there's a lot of people with toxic personalities. And every so often, you might become kind of angry, pain in the ass, trouble to deal with, and become, I guess what they'd call a toxic personality. That doesn't make you mentally disturbed. Now, you've heard me on a little bit of a rant today, and some son of a bitch will say, yep, a narcissistic, toxic personality. But actually, I'm charming, I care, I'm relatively smart, at least ask my mom, but she's gone. And I'm concerned about how mental health counseling, psychiatric counseling, psychological counseling, the field of mental health counseling, how it's treating those who cross the threshold into a mental health counseling office for mental health care because of some kind of illness at some level. And that excludes personality disorder. Hey, subscribe. I've got 4 or 5 other things posted here. Take a look at them. And I didn't go on a rant on many of them, but this one really pissed me off about this personality disorder, toxic personality, narcissistic personality. Frankly, I'm just saying be cautious. That's the whole theme of most of my, or all of my several, 4 or 5 or 6 videos. Hey, I'm going to hang up here. Enjoy. Learn from them. Talk to you later, I hope.